Pelviscopy. Introduction. Organs in the pelvis include the female reproductive organs, part of the urinary system organs, and part of the digestive system organs. Select true or false. Correct. The pelvis contains organs from different systems. These systems include the female reproductive system, part of the urinary system, and part of the digestive system. During a pelviscopy, a healthcare provider can take a tissue sample or remove a small abnormal growth. Select true or false. Correct. Can you eat or drink normally before a pelviscopy? Select yes or no. Correct. You should not drink or eat for at least 8 hours before a pelviscopy. Your healthcare provider will give you more detailed instructions. A pelviscopy is most often performed under general anesthesia. Select true or false. Correct. With general anesthesia, the patient is asleep and does not feel any pain. During a pelviscopy, the surgeon may decide to do an open surgery with larger incisions. Select true or false. Correct. In some cases, it may be safer for a patient to have an open surgery with larger incisions. After a pelviscopy, you may experience pain around the incision sites as well as in your shoulder. Select true or false. Correct. This pain is normal and it should go away in a few days. You may need to take pain medication. Thank you for using Explain.